I'm Dr. Nan Boss, owner of Best Friends Veterinary Center. I want to talk to you for a bit about pain management. People always ask me, how can you stand to put animals to sleep? That must be really hard to do. For me, putting an animal out of its suffering is easier than watching it suffer. So a lot of my goal with everything that we do with surgery, with canine rehabilitation, with any sort of injury or infection is to make sure that we are managing that pain. A lot of people have a lot of fears about giving pain medication, which is kind of weird because when we have a headache, we all just go and take some Tylenol or some Advil and we don't think anything about it. But people are often very reluctant to give pain medication to their pets. So if you're taking your pet home from surgery, or if we tell you your pet is arthritic and it hurts, please administer the pain medication. Pets are not children in their responses to pain. They are like adult people who can hide things pretty well, and in fact they're actually way better than we are at hiding pain. So when I do something like a dental extraction, this is a painful procedure. I'm making a flap into the gum, I'm removing a bunch of bone that's around that tooth root, I'm prying that root out of there. This is a painful procedure, and it hurts my heart when people take their pet home and they come back in a week later for me to recheck their mouth and they say, well, we didn't give any of the pain medication, he didn't seem painful. It's instinctive to hide pain. Most pets, instead of crying or whimpering, get quiet when they are painful. They'll go hide somewhere, they'll be less active, less interaction with their owners, not so eager to get up and go for a walk. The pain symptoms that people expect to see are really not the most common signs of pain. They feel pain the same way a person would, they're just better at hiding it. So when we send your pet home with pain medication, please give the pain medication. We've carefully considered the level of pain your pet would be expected to have from the procedure that we did. A lot of the medications we give for pain are not only preventing the pain itself, but they're preventing that swelling and redness and inflammation that recruits more pain sensation and makes things more painful. Other things to think about is that pain has a lot of adverse consequences on the body. It suppresses the immune system, are more likely to have infections afterwards, not only on the incision itself, but elsewhere in the body. Dogs with incisions, cats with incisions, if the incision hurts, they're more likely to lick and chew and bite at the incision, and then they'll get a secondary infection on the incision. One of the major ways we can tell if we're not managing pain adequately is if a pet is bothering at the incision. If a pet is having side effects from a pain medication we've prescribed, call us and we will switch to something else. Otherwise, there is no legitimate reason to ever withhold pain medication following a painful procedure. Animals have exactly the same pain receptors and chemical messengers that humans do. They feel the same amount of pain that we do. If a human would receive pain medication for a procedure, then a pet needs it too, regardless of how the pet behaves.